And that is everything.
Still trying to get every adult boosted by the end of the year.
Got extended hours, get you all boosted.
Annabelle works to protect others here at Preston Vaccination Centre as COVID put her into an induced coma last year. A year on, and she's still suffering.
I was the only one out of 7 that made it out of intensive care. So I feel very lucky. And as soon as I could get my booster, I did do. And it's just made such a difference.
That's your booster card. If you have the NHS app on your phone, that'll come up in the next couple of days.
Whether it will make a difference is as yet unclear.
People want to protect not just themselves but their families. They want to protect Christmas and try and put a ring around that.
It's enough of a ring for now, but the Prime Minister cleared changes could come at any time.
We've had a long discussion in Cabinet for a couple of hours now, a very good discussion, in which we agreed that the situation is extremely difficult and the arguments either way are very, very finely balanced, because we've got cases of Omicron surging across the country now. We've got hospitalisations rising quite steeply in London. We agreed that we should keep the data from now on under constant review, keep following it hour by hour. And unfortunately, I must say to people, we will have to reserve the possibility of taking further action to protect the public.
Leading scientists say we need action now.
The really important thing is not to say, what we might do at some point in the future, but what's going to happen now. And in many ways, we're going through what we've gone through before a number of times, of waiting, of dithering, and then finding we have a far bigger problem we would have otherwise have had and have to have far more draconian measures.
Good morning. Good morning. Good morning, everybody.
But it's so difficult for the Prime Minister to act because his MPs and even his cabinet are against him, with one member quitting this weekend.
I couldn't support certain policies, most recently on COVID restrictions and Plan B. And if you're a minister, you have to support collective responsibility, you have to support decisions of the government, and I couldn't, so that's why I had to leave.
Boris Johnson said that he wouldn't hesitate to act if necessary, and then hesitated. Scientists have been saying for days they think more restrictions are needed. But with more than 100 Tory MPs against that and members of his cabinet digging in, it's not clear that he can. Many think the current situation, particularly economic support for businesses, is unsustainable. And the uncertainty, the inability to plan our lives, feeling a lot like the week before Christmas last year. The opposition say a lack of data isn't the reason Boris Johnson hasn't acted today.
We've got a government that's hinting at further restrictions, but it's more concerned and tied up with party management at the moment than it is with public health.
Could scenes like this from The Guardian, taken at the height of lockdown, be banned in the near future? It's not clear they were legal at the time. Just one of Boris Johnson's many woes. Sam Coates, Sky News, Westminster.